3.4 million Americans, who depend on health subsidies to remain covered, may soon see their health become a luxury. What would you do if you lost your health coverage tomorrow? Sarah, a mother of two, and a part-time worker, was able to get affordable health insurance thanks to government subsidies. But, if Congress doesn't renew these benefits, she will have to choose between paying for medical treatment or insuring food for her family. And it's not just her. Millions could lose their coverage, resulting in a wave of financial and medical despair. The impact will be devastating. If these subsidies expire, the most vulnerable families will face impossible costs. The public healthcare system will be overwhelmed, and more people will seek help in emergency rooms, generating even more expenses for the government. Renewing the subsidies isn't just a health issue, it's a matter of survival for millions of Americans. Should the government cut or renew subsidies? Share your thoughts in the comments. 1. The impact of losing subsidies on the middle class. Let's start with the example of Sarah. Today, she pays an affordable amount for her health insurance, thanks to government subsidies. However, if these subsidies were reduced or eliminated, the price of insurance could become prohibitive for her and millions of other citizens. For Sarah, losing these subsidies would mean a significant increase in the cost of her health coverage, potentially representing up to 50% of her annual salary. This increase in health insurance costs would not only affect low-income families, but also many middle-class families who, until now, were able to afford reasonable coverage. The removal of subsidies could make it impossible for thousands of people, like Sarah, to maintain even basic coverage, leaving them vulnerable to high medical costs, or risks of not receiving adequate medical treatment. The loss of subsidies, therefore, does not only affect the poorest, but a wide segment of the American population that relies on these benefits for their health. 2. The direct effect on the number of insured. When subsidies were first introduced, the number of people signing up for the health insurance marketplace increased considerably. In fact, between 2021 and 2023, enrollment in government health plans doubled, largely due to reduced insurance prices. In Sarah's case, she paid approximately $500 per month for a basic health plan before the expansion of subsidies. With the help of the government, this amount dropped to about $200, making it affordable for her and her children. However, without subsidies, the price of insurance could return to unsustainable levels. The Center on Budget and Policy Priorities estimates that nearly 3.4 million people would lose their coverage in 2026, if subsidies are not renewed, and that number would continue to grow over the years. The impact would be devastating. Many Americans would lose coverage, leading to a significant increase in healthcare costs, with more people needing emergency care, or lacking access to preventive treatment. 3. The increase in inequalities in access to healthcare. What's at stake here is not only the rising costs, but also the growing inequality in access to healthcare. Sarah's example illustrates this well. She has a reasonable income, but the removal of subsidies could make it impossible for her to afford health insurance without compromising other essential areas of her life. This reflects a larger problem in the healthcare system, where, without government assistance, health coverage could become a luxury for the rich, and an unattainable necessity for the middle class and the poor. In the United States, inequalities in access to healthcare have been a central issue for millions of Americans. For people like Sarah, losing subsidies would not only mean higher health insurance costs, but also a mismatch between her ability to pay and the quality of healthcare services available. The rich, for example, can continue to access quality health plans, while millions of people in the middle class, and at the bottom of the social pyramid, would be forced to live without adequate coverage, increasing pressure on the public system and hospitals. 4. The role of companies and healthcare providers. In addition to the individual impact, changes in subsidy rules would also affect companies and healthcare providers. If Sarah, like many others, were forced to drop health insurance due to price increases, it would mean a decrease in the number of consumers for insurers, and, consequently, a potential crisis in the private healthcare sector. Companies that rely on a large base of insured individuals to balance their costs could face a smaller, more volatile market. Moreover, hospitals and clinics could be overwhelmed with an increase in patients unable to pay for health insurance, being forced to seek emergency care, or rely on public programs like Medicaid, which also face limitations in many states. The effect of this crisis would be widespread. Healthcare providers would face growing financial pressure, and many might start reducing their services, or even close their doors. 5. The political choice and its effects. The issue of health insurance subsidies is undoubtedly one of the most debated topics in U.S. politics, with significant partisan divisions over the best way to handle the healthcare system. Sarah's example shows how political decisions can affect citizens' daily lives. For the government, subsidies are an economic tool to ensure healthcare is accessible to everyone, but many critics, especially among Republicans, argue that the costs are unsustainable and harm the economy. If subsidies are removed, many state governments will have to choose between cutting health benefits or raising taxes to cover the gaps. This could also harm the public's trust in public health programs, creating a vicious cycle of uncertainty and insecurity. Sarah, for example, if she saw these cuts, might wonder if the American healthcare system is truly sustainable and fair for all social classes, or if it is tilted to benefit only the richest. 6. The long-term crisis, impact on public health. Over time, the lack of subsidies could lead to a public health crisis. In the long run, the consequences could be even more severe than the loss of coverage for millions of people. The increase in untreated chronic diseases, the overload of hospitals and healthcare centers, and the decline in the overall quality of medical care would be some of the negative effects of a decrease in the number of insured individuals. Additionally, inequality in access to preventive care and medical treatments would result in an increase in preventable deaths and high social costs. For Sarah, this means that the healthcare system is not only failing in terms of coverage, but also creating a cycle of poverty and illness in which she, like many others, would not have access to the medical care she needs. This scenario could have repercussions for the social well-being of the entire country, increasing pressure on public services, and creating an unsustainable burden for citizens and the government. Conclusion: what's at stake? The issue of health insurance subsidies is much more than a financial or partisan political matter. It is an economic question, and about how the United States will handle the health care of its citizens in the coming years. For Sarah, the end of subsidies could be devastating, but she is just one of millions of people facing this dilemma. The future of health coverage in the United States depends on political decisions that will inevitably impact the lives of millions of middle-class families, like Sarah's, who deserve a healthcare system that is accessible and fair for all. Should the government cut or renew subsidies? Share your thoughts in the comments and subscribe.